What daily amount of EPA and DHA should one be consuming for optimal health? What are the risks of too much and too little? And do adult men and women need different amounts than children?
The Nutritional Research Foundation supported a study done by researchers where they followed the DHA omega and EPA omega-3 index on about 150 long-term vegans. And they found that about 60% had levels below 4. But there were 20% with levels above 5, which was adequate. So that meant that these were non-supplementing vegans. And of course, like 20-30% had super low levels, almost non-existent levels, but just between 0 and 2.5, putting them at really heightened danger of depression or dementia. So for most people, we give people between, let's say, 200 and 300 milligrams of EPA DHA. Like I have a dropper where people take it in a vegan sourced plant-based EPA and DHA. And most people, including myself, take about 250 to 300 a day, one dropper full a day.
Okay.
But that doesn't mean that as we age, it might be appropriate, and I'd have to do it on myself, to check your omega-3 index and see, based on your diet and your genetics, is that amount you're taking the right amount? Is your omega-3 index above 5 where it should be, or is it still a little low? In most cases, we found out that that amount was enough to push the vast majority of people into the normal range. So I think that's a good amount, between 200 and 300 milligrams a day.
Okay.
For most people. But there are some people who have adequate levels with none. You know what I mean? And some people that probably need more too.
What tests are there specifically to, if somebody wants to get tested and see if they're...
The best test is called omega-3 index, because it's very easy to remember. It tells the percent of of DHA and EPA compared to omega-6 on the cell membranes. And as you gain weight and get overweight, your omega-6 goes up in your tissues and your omega-3 index goes down. So losing weight helps you restore the level back to normal as you and supplementing too.
Okay.
So it's something of a strong concern of mine, because as a physician in primary care, taking care of elderly vegan communities, I saw and by the way, all my mentors, I got into this originally through the natural hygiene movement because my father was sickly and read books by Herbert Shelton of the natural hygiene fame, and eating more natural foods and and all these mentors and people I used to hear lecturing on the advantages of eating fruits and vegetables and things like that, and who lived that lifestyle. They lived a relatively long time, but a lot of them became demented and developed Parkinson's. Almost all of the people I respected developed some neurological disorders after they aged. And it made me more concerned about what's going on here. They didn't have heart attacks, they didn't get cancer, they developed some brain issue. So I started checking blood on everybody for omega-3 index, finding a lot of elderly vegans with very, very low levels, and particularly those elderly vegans who developed Parkinson's had super low levels. And there's some indication in the scientific literature, particularly with animal studies, that very low levels of DHA and EPA could make your brain more sensitized and more vulnerable to the toxins that can cause Parkinson's disease. Mm-hmm. So I was alarmed because like Dr. Shelton and Kiki Sidwa and all these doctors who I knew were super healthy developed Parkinson's disease on vegan diets, you know?